Degenerative disc disease of the cervical spine, which is basically osteoarthritis, wear and tear, aging of the discs, which can result in neck pain. So if you wake up with a stiff and painful neck, and then it takes 20 to 30 minutes and a hot shower to loosen up, and then towards the end of the day, after you've carried the weight of your head around all day and worked and done everything, your neck starts to hurt again, it can be from degenerative disc disease of the neck, of those discs wearing out. The other things that the degenerated disc can cause a pinched nerve and pain and numbness and weakness to go down one of your arms or both arms. Another thing it can cause is spinal stenosis, which can affect your spinal cord and cause myelopathy, which can cause clumsiness of your hands, difficulty doing buttons and fine motor control, can also throw your balance off, or you can't walk in a straight line heel to toe. So if you have either one of those conditions, please watch the video for cervical radiculopathy, which is a pinched nerve. The other one is cervical stenosis, which can be pinching of your spinal cord. But if you just have neck pain and you don't have the neurologic component, it's basically a degenerated disc in the neck with neck pain. And it hurts when you move your neck, limitation to motion. You've had an MRI and x-rays and studies that confirm a degenerated disc in the neck without a neurologic component. The treatment typically is non-operative, because if you get your muscles strong, you can put your head in a better position to decrease the effective weight of your head. See, when you're sitting slumped over, your head sticks out, it weighs more because it's away from the axis of rotation. And also that stretches the muscles out, and if you extend your neck, it closes the holes where the nerves come out, can cause some nerve irritability. So our whole core program, our rehab program for necks, is get your core strong, get your scapula stabilizer strong, get your postural muscles strong to put you in a better position. Stick your chest out, let your shoulders fall back, brings the head back over the rest of your body, effectively decreases the weight of the head, opens the holes for the nerves, puts the muscles in a better position to do their job. So if you're interested in doing that, please watch our video on the neck rehabilitation that goes over a comprehensive way to decrease neck pain and to strengthen the muscles to put you in a better position. From a surgical perspective for degenerative disc disease of cervical spine, it really depends on, do we know what's causing the pain? If it's just one disc that is shot, that looks degenerated and looks terrible, and the other discs look normal, well then the pain may be coming from that disc and surgery may help. But if you have 5 discs with degeneration throughout them all, we're probably not going to recommend surgery because we don't even know which disc is causing the pain. And the surgery would be much more major to operate on multiple discs. So 1 or 2 levels is typically what we operate on for neck pain, but only in select cases. It really depends on each individual case. So if the disc is degenerated, the other thing we have to make sure of is that the facet joints aren't degenerated. For every disc in the front, you have 2 facet joints in the back. So if it's just a degenerated disc, there's 2 different options of treatments. There's an artificial disc replacement or a fusion. And the fusion's the gold standard, been around forever. We basically take the painful disc out, put a piece of plastic or bone in the middle, put a plate on to stop the motion. Bone grows across the disc base, it never moves again, it never hurts again. So the fusion treats the disc pain. It also treats facet joint pain because they never move again. And it treats the nerves and the spinal cord. So a fusion is the most common surgery done all over the world because it treats everything. However, the downside of fusion, if the fusion stops the motion, that segment never moves again, it can put more stress on the discs above and below and accelerate the wear and tear of the other discs. And then pain may start in a couple of years from the next disc, and then it has to be operated on. So the alternative surgery is an artificial disc replacement, same basic surgery. We take out the painful disc, put in the artificial disc, which preserves motion, therefore puts less stress on the discs above and below. But it doesn't treat facet joint pain, and so the key is the workup, really identifying what's the source of the pain. Is it one disc? Is it just the disc? Is it the facet joints? Is it the nerves? Is it the spinal cord? Helps determine the treatment. So you have 2 options at this point. One is to watch the video either on the fusion or the artificial disc replacement or both. The other option is to contact us directly. You can email us at info@watkinsspine.com and we can help guide you through the process. Thank you.